Now we are going to start with Professor Hani Mowafi, who's going to talk to us about the current concepts in dealing with complex food deformities. Professor Hani.
Thank you, Professor Ahmed. Firstly, I would like to thank Professor Ahmed to join us in this foot and ankle meeting. And also I'd like to thank Pfizer and Upjohn Pharmaceutical Company for hosting this meeting cooperated with Egyptian Orthopedic Association. I'm speaking about current concept in dealing with complex food deformities. But firstly, I would like to define what is a complex food deformity. It is a multiplanar deformity, and it is it is a combination of true bony deformities and also joint contraction. But my talk today is what is the goals of the treatment and management of the complex food deformities. Before I speaking about the goal, I reviewed some presentation or papers or researches about the complex food deformities, which also said about the complex food deformity. Here it is an presentation and papers published in 2018, which usually concluded that although complication rates were high, and also the majority of the treatment goal were met. How comes? I don't know. Also, this is a paper presented or published in 2006, one in the Foot and the Ankle International, which concluded that a laser of external fixator allows simultaneous correction of all severe foot deformities. In the second paper, which published in Pediatric Orthopedic, said that results in laser of external fixator has a poor outcome associated with residual or recurrent deformity, and it is requiring revision surgery. The other in Pediatric Orthopedic British, which concluded that the functional results were better in Elazarov, but actually in these patients, in spite of poor surgical outcome. And another paper presented in or published in 2018 concluded that nevertheless deformity recurrence can be observed in some cases, and the treatment remains challenging. So distraction osteogenesis should be reserved as a salvage solution for particular complex. Before, the goal consists of 4 items or 4 goals. The first is painless, plant grade, functional, and also cosmetically acceptable. So this is our goals before in treatment of complex foot deformity. And so I present as these cases for a lady. It is 28 years old, type 1 diabetes, sustained road traffic accident since 2001. And she came to us with complex foot deformities, also shortening, and she did a mini operation prior to come to us. And this is an X-ray. So this is patient underwent to lengthening and correction of the foot. And after correction, there is a slight residual deformities, inverse deformities for the foot, but she was happy about this correction. So I remember I published paper in 2004 about assessment of percutaneous V osteotomy, and I concluded complex foot deformity of any cause treated with Elizarov. Sometimes when I think when I was young, I was enthusiastic about the technique, and so I can treat everything or with any causes of complex foot deformity with Elizarov technique. But actually, after 4 years, the patient came to me with the same deformities, also added to the ulcers. So I recommended to amputation for the patient, but the patient refused. And I'm going to do what is called percutaneous V osteotomy for this patient. And so the goal is usually a little bit different. As first, painless, I'm agree about painless, plantigrade, functional, and cosmetically accepted. But also, I have to make something to prevent a recurrence. So I'm thought about these cases. The main cause we have to looking for the main cause of the deformity and the patient age and how many operations were done, and also the bone morphology, which is very important if it's osteoporotic or not, and the degree of stiffness of the foot. And so with this patient, the bone is little bit osteoporotic. So what I did here the patient percutaneous osteotomy first, and also I didn't do an osteogenesis distraction. I did osteogenesis compression by correction of the foot with compression to get more stiffness of the small joints of the foot. And this is a patient after complete correction, and this patient 10 years follow-up, which is usually it is without recurrence and also without complications. So I published a paper in 2009, and I concluded that we found that recurrence depends on many factors, such as bone morphology, number of previous operation, degree of stiffness of the foot prior to the operation. And this is also, I did this for the patient with an example to prevent the recurrence. This is a patient with infection in fifth metatarsal. And one surgeon took off the fifth metatarsal completely, and the patient got this deformity after 1 year from the operation, from the amputation of the fifth metatarsal. And he came to us, and we found that, yeah, it is little bit is good. So we did normally distraction osteogenesis for these cases. But at the end of the correction, we did what is called calcaneocuboid fusion to prevent recurrence. And so the patient is doing well. But after 5 years or 6 years, the patient came with metatarsalgia and also ulcers in the lateral, in the fourth and third metatarsal head. So this complication, I think it is due to the correction also. Of course, we have to know it is a challenging problems because we need more about to understand more about the to prevent recurrence and to also prevent the complication for the patient. So our goals now, it is just as a painless plantigrade function, cosmetically accepted, and also how to decrease the recurrence. This is must be your goals, and also how to decrease the complications for the patient. So if you are looking to the painless plantigrade functional cosmetic acceptable, you have to get 5 issues, which is very important, or 5 items. The main cause of the deformity, which is very important, and also the patient age to make what is the type of operation is suitable for the patient or appropriate for the patient, and how many operations were done, also bone morphology and degree of stiffness of the foot before the correction. But actually, to decrease the recurrence, and also to decrease the complication, it is very important to do what is mechanical analysis of the deformity, to know what is the cause of the deformity, and to to prevent this deformity again, and also how is the plant grade foot, or how tribodal of the foot, which is the tribodal, mechanically is accepted or not, to prevent another complications for the patients. So as we see here, there is different types of complex foot deformities, but actually we have to know that many of those deformity, it is usually a result of combination of muscular and anatomical and neurological dysfunction for, for the foot. So yes, it is a bony deformity which is responsible for this deformity, and sometimes contracture of the soft tissues, but also don't forget the neurological affection, which also it is the main cause of the deformities, especially in the foot. And we have to do a many options or many imaging studies about the foot. For example, CT, 3D dimension, also foot pressures to show the point of pressure or high pressure areas from the foot, to detect which is you have to correct this high pressure area or high pressure point to prevent any complication there. For example, here this is a patient with a residual talus, and also he did a mini operation, and X-rays show that the bone is not deformed, and also the joint congruity it is not bad. So we decide to do what is called an distraction osteogenesis. But actually, we did what's called also adjuvant operation, soft tissue operation. Like here, we did what is called an modified joints, and also lengthening of Achilles. And this is a patient here after correction. This is a guy about 13 years old, was treated with percutaneous V osteotomy. He has bilateral residual talus, and also the patient recurrent talus, and also the patient underwent a mini operation for this. So we did percutaneous V osteotomy. As we see here, there's some little bit on foot bony deformity, and also there is a contracture. So we did V osteotomy, and we begin a contraction. And the degree of stiffness for this foot is usually the same, but this is a patient after correction here. And this is a patient before and after the correction. Another example for surgical reconstruction, this a patient is sustained a road traffic accident with deformity, and also he did an operation, plastic surgery, and we found that here there is a deformity for the foot, and also here the talus, and also the patient had just an valgus deformity or malunited tibia in little bit valgus deformity. So we did here on the lateral ray arthrodesis, and also we make calcaneal osteotomy and correction of the foot. And here the patient with a good alignment, and also the foot is a good alignment for this. Another example for complex foot deformity, here this is a patient is a lady about 18 years old, and this patient underwent an amputation to the uh, to the right foot, but and Left foot, it is usually underwent, has a complex deformities. And this patient, and how the patient is walking, and usually she needs an help or support during walking. And of course, this foot is, if we analyze this foot, we found that the talus, it is the ankle joint, it is not congruent the with the talus. It's the first, and the second, it is a very precious foot, as the patient has an amputated another foot. So we did an a simple way of telectomy for the patient with anteromedial incision and also lengthening to the Achilles here. And the patient now, after correction, this is after about 2 months from the operation, and the patient with, this is the left limb was amputated. Sorry, the right limb is amputated while the left limb is corrected. Here, after 1.5 years from correction, and the patient here during walking before and after correction, and they walk without any support. So we can conclude each cases must be treated individually. Open surgery or circular frame, both methods are considered in treatment of complex foot deformity. The most important thing, what is the appropriate technique, must be usually for the complex foot deformity, and that the appropriate technique must be as regard to the foot deformity, which helps the patient to get a good results without, at least not without a complication, but to decrease the complication or decrease the rate of recurrence. So also we have to know that the main cause of deformity, the age of the patient, and the number of operation prior your surgery, and quality and shape of bone configuration of the joint, and the degree of stiffness is important. But the most important one is analysis of foot deformity biomechanically, which all are the cornerstones in treatment of complex foot deformity to get painless plantigrade function cosmetically, and also, which is very important, to decrease the incidence of recurrence, and also to decrease the incidence of complication. So for me, if I said that what is our goals, and the goal must be have a destination, but actually the destination of the complex foot deformity management has infinity. And thank you